Hello, everyone, and welcome to today's COVID-19 community conversation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. If you're listening in on your computer speaker system and would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the webinar. Time permitting, we will address them at the end of today's presentation. And now I'd like to introduce today's presenters. First, UMMS President and CEO, Dr. Mohan Suntha. And second, UMMS Incident Commander, Dr. David Marcozzi. Today, Dr. Suntha and Marcozzi will be addressing several topics of importance to our communities, and they are caring for our communities, caring for our patients, and caring for each other. And the first topic we're going to address is caring for our patients, and I'm going to now turn it over to Dr. Suntha.
Thank you, Chris, and I want to thank everybody for joining us for this weekly update. I know your time is valuable, and my hope is that you find these webinars as a valuable resource as the medical system moves quickly to continuously adapt to the challenges that lay ahead based on the information that comes to us throughout the nation and from around the world. You are an invaluable part of the COVID-19 response in our communities throughout our state and indeed the nation. And we know that this can be stressful and an anxiety-provoking time, and that we are asking all of us to make extraordinary sacrifices at this time. But please know that from the healthcare workforce perspective, the efforts that our communities are making around social distancing is the single most impactful way that you can say thank you to the healthcare workforce who are putting themselves at risk in order to care for the patients who are coming to our organization. The impact that you have by demonstrating social distancing tells us that that is the single best way that we have to help flatten the curve and slow the spread of the disease. And so you are appreciated, and it is why we are continuing to give you this information to help reinforce the impact that your efforts are making. And so I want to thank you, and I want to now start by giving you a global status of where we are. Around the world, we have now seen over 1 million people with confirmed diagnosis of COVID-19. And here in the United States, we've seen that number grow to 245,000 confirmed cases, more than that number, as that number changes hourly. There is no question that here in the U.S., as around the world, we will see that number rise as our testing capacity increases. In Maryland alone now, we have more than 2,700 citizens diagnosed with COVID-19, and we have lost 42 Marylanders to this diagnosis. It is clear that this virus does not discriminate and that it has the ability to spread throughout communities, whether they are large or small. Governor Hogan issued a stay-at-home order directing that no Maryland resident should leave their home unless it is essential for a job or for an essential reason, such as obtaining food or medicine or seeking urgent medical care. The medical system workforce is an essential part of this response and therefore meets that criteria. And while many of you may be working remotely, it is critical that you keep a safe distance from each other. And we greatly appreciate that effort, as it has the impact that I referred to earlier. In terms of the medical system, we know that the surge is coming. We can see it in the data that we are starting to experience increase in the number of patients who are coming to us with symptoms that would suggest that they are impacted by this disease. Across our system, within our member organization hospitals, we now have over 65 patients who are under investigation, and we have 83 patients who have a confirmed diagnosis of COVID-19. So we have, across our health system, extended our cancellation of elective surgeries and elective care through April 15th, and we continue to cancel routine healthcare appointments through Friday, April 17th. We're making these decisions in coordination with healthcare partners across the state, and we are doing so in order to keep our community safe and our healthcare workforce healthy. We have, in concert with those decisions, launched an expansion of our healthcare telehealth services so that we can try to directly interact with patients in their homes with their healthcare providers. Governor Hogan has issued an executive order that expands telehealth services to go beyond audio-only methods. And it's these abilities of enhanced telehealth capabilities and measures that allow our providers increased flexibility to connect with members of our community in their homes. And by doing so, again, minimize staff exposure to asymptomatic carriers of COVID-19. We are now, again, learning from data that comes in across the world that anywhere from 25% to 33% of patients who actually are diagnosed with this disease by testing are asymptomatic carriers of the disease, and that's why it's so important for us to recognize the value of the social distancing that we're discussing. So again, we are your partners in terms of protection, and we so greatly appreciate the outpouring from community resources to try and provide increased protection to our healthcare workforce. We've talked a bit about our community partners such as Under Armour, who rapidly transformed their manufacturing into producing face shields and face masks and fanny packs for our healthcare workforce. They are now manufacturing more than 500,000 fabric face masks and 50,000 fanny packs to allow healthcare workers across the state to be able to provide resources that allow healthcare workers to use appropriate PPE and also allow visitors and or needed non-clinical workforce appropriate protection as we continue to evolve our approach to how to best protect our workforce and our patients in partnership with community partners like Under Armour. As we've canceled elective surgery to free up valuable hospital-based resources, we recognize that we have to continue to do more. We have to be creative in our concepts of where it is that we can deliver health care. We're proud to partner with other healthcare organizations like Johns Hopkins Health System and the state of Maryland to create an access point at Baltimore Convention Center, where approximately 100,000 square feet in the convention center are being converted to create a hospital facility. We are targeting the end of April, and again, federal partners like FEMA have delivered 250 beds to support hospital beds to support this type of initiative. We're also working around the clock at the state's request with community partners to actually retrofit the University of Maryland Laurel Medical Center, part of the Capital Region Health System, to temporarily reopen inpatient beds at that facility as part of the Capital Region's response to COVID-19 in partnership with again, the Prince George's County leaders to be able to do that in a way that, again, increases the entire statewide access for hospital beds. We continue to look at partnerships with hotels, to identify places that lower-risk patients could go who aren't quite ready to go home and need some level of supervision before we send them home. I also want to touch base on a topic that is clearly a challenge in this nation, and that is testing of COVID-19. It remains a major priority for not just our health system, but around the state and indeed around the country. One major bottleneck of testing is that all of us have been reliant on external testing capabilities as we started to plan for this surge. Our health system, like many, have continued to stand up internal testing capability, and across many of our facilities, we now have internal testing capability for our patients who are in our hospitals, and that allows a far more rapid turnaround time of those results, which allows us to impact the care we're providing and at the same time preserve the valuable protective equipment that our staff need. We continue to work on this because ultimately this limitation of testing defines in large measure our ability to slow down the spread of disease. As we can expand our testing capabilities outside the walls of the hospital to community testing sites, that's when we'll be able to identify members of our community who don't require inpatient care, to be aware of their condition and their status and act appropriately with that information to help limit the spread of this disease. So we are working with the Prince George's County Department of Health, the National Guard, the Maryland State Police to stand up a screening and testing facility at FedEx Field in Prince George's County. Here in the city of Baltimore, we're working with partners including Johns Hopkins Health System, Care First, the city of Baltimore, and state of Maryland to identify appropriate locations within the city to do a similar sort of effort. We've stood up a medical system nursing call line where patients who are wondering whether they need to come to the hospital can in fact call a number and actually speak to a healthcare provider before coming to the hospital to understand what is the best approach to their particular circumstance. All of these are efforts that we're putting forth to try and expand our ability to connect to the community outside the walls of the hospital. That will continue to evolve over the coming weeks, and we would ask you to stay tuned and stay focused on understanding how that capacity expands, not just for our health system, but around the state as we try to combat this challenge with information in our communities.
Thank you, Dr. Suntha. Now we're going to move to our second topic, caring for our community, and I'm going to turn it over to Dr. Marcozzi.
Thanks, Chris. Thanks, Dr. Suntha. Again, I'm honored to speak to you all today about some of this, the concerns around this virus, and walk you through some symptoms and what we can do if you're concerned about these symptoms. So the majority of people who experience this and are infected by this virus, COVID-19, are going to experience mild symptoms: fever, cough, maybe some mild shortness of breath, some sore throat. There's even some stories that you may have a little bit of loss of smell or taste. The challenge is when these symptoms get more severe and you start having complications like pneumonia. Who's going to develop these things? What we're finding right now is folks who are older or folks who have chronic diseases. They're more susceptible to this virus, and we need to be wary of that as we walk through this virus, which means that every one of us has a responsibility to protect those who are going to be more at risk, and I'll walk you through a little bit of that later. It doesn't mean that young people don't get this virus. They do, in fact. Everyone could potentially get this virus, and everyone actually might be carrying this virus and shedding this virus. So it's a point of concern, and you need to be aware that some of the things I'm going to walk you through now needs to be kind of owned by everybody. We all share the responsibility to fight back against this virus. It's importantly to also note that you don't need to come to the hospital unless you feel it's a true emergency. Instead, I'd recommend you're calling your healthcare provider, or even what Dr. Suntha spoke to, that 24/7 nurse call triage line is staffed by a nurse all the time. You can make a phone call, and you can come online with that. I'll talk a little bit more about that nurse call line now. The fact of the matter is you have the availability. If you're not really sure of what your symptoms are, if you're not really sure of whether or not this could be a virus or anything else, give a call to that number. The number's right there, 888-713-0711, and give a call to just kind of talk through what your symptoms are and what the best recommendation would be about next steps. You can also go online to the CDC, and that CDC website's listed right there if you've got access to a computer. And go online. It's called the Self-Checker tool, and you can kind of identify what might be some risks with regard to having this virus. Next slide, please. So this is fundamentals. This is about hand hygiene. It's about keeping yourself protected. So you're a critical partner in this effort. I can't emphasize that enough. And as part of our larger community, every person as part of that community, from young to old, needs to embrace similar protective measures that we can all take to protect not only ourselves but our loved ones from this virus. So we need to encourage the maintenance of practices around physical distancing, proper hand hygiene, consistent cleaning and disinfected with high-touch areas. That will allow our communities to be protected against COVID-19. And this requires work and sacrifice. But the more we do now and the measures we take now, the better we'll be, and the more we'll be able to keep our communities healthy, and we'll be able to flatten that curve. Importantly, we need to stay away from folks who are potentially sick. And washing our hands if you are sick or caring for someone who is sick, that'll help limit the spread of this virus. Let's talk about simple things about washing your hands. You know, as my 5-year-old says, you need to wash your hands while singing the alphabet. That's about 20 seconds. And that's true washing your hands, not necessarily just running your hands underwater. If you're in a public place and you need to blow your nose or coughing and sneezing, make sure it's protected and make sure you're covering your cough or you're covering your sneezing. Use soap and water when it's available. And if it's not available, then please try and use hand sanitizer, which I know is on short supply, but there's always soap and water available, so try and use that. Next slide, please. I'll talk to you a little bit about some social distancing, or what we call physical distancing. We try and adhere to Governor Hogan's stay-at-home order, and that's important, and only leave your home for essential purposes. Avoid close contact with people who are sick. Practice physical distancing, which means keeping approximately 6 feet between you and other people, especially if you are at higher risk. Next slide. As I talked about, cover your mouth when you sneeze or you cough. That's important to help spread this virus from either from a person to person or from a person to a high-touch area that then gets touched by another person, and then all of a sudden that person becomes infected. And if you do, and if you can start to do this, would be great, is try to avoid touching your eyes, your nose, or your mouth. And if you see someone doing it, say, hey, listen, try not to touch your eyes, your nose, or your mouth. The more we limit those touching of those high contact areas, the less this virus will be transmitted. Next slide, please. Keeping surfaces that are high touch areas clean is critical right now, and we're all in this together. And keeping those areas clean helps keep other areas less infected and limits the transmission of this disease. So care for your neighbor, care for each other, whether you're self-quarantining if you're sick or whether you're helping a neighbor with groceries. Make sure your hands are protected. Make sure their areas of high touch, handrails, doorknobs, light switches, all keep clean, and that will allow this virus to be transmitted less. Next slide. Here's a very important part of fundamentals of what we do every day. Governor Hogan emphasized that stay-at-home order. And communities, our clergy, our religious leaders need to make sure that they're echoing out across our communities so that folks stay at home. The less this virus is transmitted, the less this virus has the potential to create illness in our communities. And part of that is things like a grocery store. So make sure you're wiping down your carts when you go to a grocery store. Go in for what you need and then get out of the grocery store. Don't stay in there too long and walking around. This is not time to have a social conversation in a grocery store. Get what you need and then get out of the grocery store appropriately so you can keep that social distancing practice. Next slide, please. When you bring your groceries home, make sure that if they're in a bag or they're in a milk carton, wipe them down before you put them away. This virus can stay alive for about a day. So if you keep and wash your groceries when you get home, whether or not it's cardboard or plastic, if you wash them down, that'll decrease the transmission of this virus once you're coming back from the grocery store and putting things like in your refrigerator when you're putting things away. And that's important. And then after you do that, I need you all to wash your hands after you touch these groceries. So when you've gotten home from the grocery store, you wipe down these different groceries and you put them away, then come back and wash your hands thereafter, as we talked about. Next slide, please. Fundamental for our physical health is also our mental health, right? So we're not just physically well, we're mentally well. And as we start having more anxiety as we walk into this virus collectively, we walk into this healthcare challenge collectively, we need to know that we can rely on each other. And we need to know that we should make a phone call if you're having some mental health, or you're having some anxiety or mental health concerns. This is the time to prepare, and don't panic. Reach out to friends through social media, through text, through phone calls, through video, so you can feel as though you might be socially distancing, but you're not socially isolated. And that's an important piece. So take breaks from responding, and all of us are responding right now. Make sure you're staying connected with family and friends and your religious colleagues, religious leaders, and your community leaders, so that we all know that we're working as a team as Baltimore City walks collectively together to respond to this healthcare threat. Next slide, please. Lastly, we're not leaving you without some potential resources. And there's a disaster distress helpline, which list is right there, 1-800, and I'm going to walk through this slowly so we don't just go to the next slide. 1-800-985-5990, or text Talk With Us, and you can have someone available to talk to you. Or there is a crisis text line, and if you text TALK to 741-741, you'll have someone at least be able to text with you. And then finally, you can use the city's 211 or the website 211md.org to make sure you're able to connect with the service and get what you need during this healthcare challenge. I'll turn it over to Dr. Suntha and Chris for some other additional information.
Thank you, Dr. Marcozzi. And now we're going to address our third topic, caring for each other, and I turn it back to Dr. Suntha.
So thank you, Chris. Thank you, Dr. Marcozzi. There's no question that this is an unprecedented time for our communities, for our state, for our nation, and through all of the challenge that we've collectively encountered, I think it is important to recognize how many examples we have of how we have come together as a community. I've been heartened by the outreach from our community members wanting to help our medical system staff and our patients. We've in fact been inundated with requests wanting to know how can individuals help. So we've launched a brand new campaign, webpage, that is ums.org/COVID-help, where you can just learn about different ways that individuals can help in this fight. There's information on how you can make in-kind donations for our workforce, such as PPE or sanitizing supplies, or how to create cloth masks. We've been impressed with the ingenuity that we've seen across our communities. And there's, in fact, a website, and there's the ability to create cloth masks, and we will take those masks, and we will have our infection prevention and supply chain leaders inspect them and make sure that they get put into circulation to help our communities and our workforce address the concerns around appropriate protection for our patients and our workforce. We've also been inundated with individuals wanting to volunteer their time and their energy to our organizations, and again, we're humbled by that. We have, again, the requirements and the need to make sure that we continue to protect our volunteers, our workforce, and our patients, and safety and well-being of all those who enter our facilities must be at the front of our mind as we think about these acts of kindness. And so we have guidelines that you can see on your screen that help identify who are the individuals who can offer their time and their energy, and who are the individuals who should be careful, despite their energy and enthusiasm to help, about coming forward in that volunteer role. And so now I'm going to turn it back to Chris, and we're going to answer some questions that are coming in to the organization.
Thank you, Dr. Suntha. First question is for Dr. Marcozzi. How many have recovered in the U.S. and in Maryland?
You know, as of today, we've had an estimated more than 9,000 people across the country have recovered from COVID-19. And it's important to also note that the majority of patients who contract this virus are asymptomatic. And also people who are getting ill are getting better. So it's important to recognize that, you know, we need to make sure that we're all doing our best to limit the virus, but it's also important to note that people are recovering from this virus.
Thank you. Next question is for Dr. Suntha. How many cases of COVID-19 are there in the state of Maryland?
So in the state of Maryland now, we have more than 2,700 Marylanders have been diagnosed with COVID-19. And going back to the question that you put forth to Dr. Marcozzi, within the state of Maryland, we have 159 identified patients who were hospitalized who have since recovered from COVID. Now, we have to recognize that that data information flow is going to be slower on the back end in terms of the recovery of those patients than it is on the front end, which is when we identify them as they come into our organization.
Thank you, Dr. Suntha. Next question is for Dr. Marcozzi. I'm at home because I work at a school. However, my husband still goes to work every day. What recommendations do you have for him as he returns home every afternoon?
Yeah, it's a great question. So I think that, you know, you got to balance your health with the ones that you loved, with your loved ones at home, and every effort should be made to avoid any high-risk family members and clean high-touch surfaces frequently. You know, I always like to think about it. I have work clothes and then obviously clothes when I come home and I change into, and making sure that you are doing your best to not allow this virus to be transmitted, which means when you come back into the house, kind of changing into your home clothes and laundering your current work clothes is an important piece. Also, making sure that the person's coming home from work washes his or her hands, or in this case, obviously, her husband's hands, and covers their cough and uses sneeze etiquette, and make sure that they're able to stay away from anyone who's potentially high risk from contracting this virus. That's an important piece. Obviously, more details can be available, and as Dr. Suntha said, what you might want to try to use is a website that's umms.org/COVID, and you'll give you some answers to some of those other questions that you might have with regard to this.
Thank you, Dr. Marcozzi. We have time for one last question, also for Dr. Marcozzi. How does an uninsured person get referred for a test since they have no primary care physician?
The University of Maryland Medical System has established a free nurse call line, as I talked to you guys about, 24 hours a day, 7 days a week, to answer any questions about COVID-19. I'm just going to say that one more time. For the number is 888-713-0711. And all those calls are directed by are directed to an operator, which then gets a nurse on the line to allow you to understand where you could potentially get tested if you need to get tested, and who is licensed in Maryland, and to reach out to you with regard to any caller, so they'll return a call back to you and get the information you need when you need it.
Thank you, Dr. Marcozzi. And now I'm going to turn it over to Dr. Suntha for some closing thoughts.
Again, I want to reemphasize our gratitude to all of you who've taken the time to join this webinar. Again, the goal has always been to provide information, and as you can tell from this week's webinar, maybe as compared to last week or the week before, the information continues to flow on a constant basis. And we are trying to present to you all the most updated information that we have. I will close today with a reminder, and that goes back to Dr. Marcozzi's appropriate focus on social distancing and our collective belief of the impact that this has. We, in this country, we are coming upon an important time in many faith traditions. The season of Easter and the season of Passover are two very important holidays in both the Christian and Jewish faith traditions. And we recognize that in this year, the way we celebrate and recognize these holidays are going to be foundationally different. And we would ask all of you to communicate effectively the importance of maintaining social distancing during this time of religious celebration. And it is not just during the day, during Easter Sunday, or at the celebration of a Passover Seder. It is, in fact, how you prepare for those holidays as well. So again, being very mindful of public presence, whether it's at the grocery store, etc., is critically important at this point in time in order for us to bend the curve and actually impact and decrease the rate of transmission of this virus. So again, on behalf of the medical system, School of Medicine, the University of Maryland, Baltimore, our partners in the community and across the state, thank you for taking the time with us today.
Thank you, Dr. Suntha, and thank you to everyone who participated in today's webinar. As a follow-up, within 48 to 72 hours, we will post a recording to today's webinar along with answers to the questions you submitted on the UMMS COVID-19 response site. We encourage you to go to that site in the community regularly to learn the latest news and information about what UMMS is doing in terms of its COVID-19 response. On behalf of Dr. Suntha and Marcozzi, thank you for joining us today, and have a great weekend.